Today we will learn about the effects of exercise rehabilitation on blood cells. First, let's look at red blood cells. Exercise can cause a temporary increase in the number of red blood cells. The extent of this increase is related to the intensity and duration of exercise. During short-duration exercise, stored blood is released. This increases the number of red blood cells in the circulating blood. Within the normal viscosity range, an increase in red blood cell count and hemoglobin concentration enhances oxygen transport capacity. During high-intensity, prolonged exercise, plasma osmotic pressure increases. This leads to hemoconcentration, thereby relatively increasing the concentration of red blood cells. The temporary increase in red blood cell count during exercise usually returns to normal within 1 to 2 hours after exercise ceases. Individuals who exercise regularly and athletes have a slightly higher total mass of red blood cells and hemoglobin at rest compared to sedentary individuals. However, because exercise causes a more significant increase in plasma volume, the increase in red blood cells is less than the increase in plasma volume. This results in a decrease in both hematocrit and hemoglobin concentration per unit volume. This phenomenon is termed athletic anemia, but it is not true anemia. A lower hematocrit at rest reduces blood viscosity. This improves blood fluidity. This has a positive effect in preventing various cardiovascular and cerebrovascular diseases. Because exercise accelerates the removal of senescent red blood cells, it also speeds up the renewal of red blood cells. New red blood cells have membranes with better elasticity and deformability. This improves blood fluidity to some extent. Exercise can enhance the body's immunity and improve physical fitness. Consistent, appropriate exercise over years can induce a positive immune response in lymphocytes. This enhances the body's immune capacity to some extent, thereby reducing the risk of disease. However, prolonged, exhaustive exercise or chronic overtraining can negatively affect immune function. After prolonged, exhaustive exercise, lymphocyte counts drop below resting levels. The activity of natural killer, NK, cells also decreases. Immunoglobulin levels and function are also affected. The body experiences a temporary immunodeficiency. This state can last from 3 to 72 hours. During this time, susceptibility to illness is increased. This period of reduced immune function is called the open window period. Platelets play a key role in the development and progression of cardiovascular diseases. Platelets are importantly involved in the formation of atherosclerosis, coronary artery spasm, myocardial ischemia, myocardial infarction, or sudden cardiac death. Moderate aerobic exercise can inhibit platelet activation, thereby reducing the occurrence of thrombosis. High-intensity strenuous exercise increases platelet aggregation and activation, leading to a hypercoagulable state of the blood, especially for cardiovascular disease patients who are usually sedentary. Short-term strenuous exercise can increase the risk of myocardial infarction. In summary, exercise alters the state of blood cells in the human body. Appropriate exercise can promote physical rehabilitation. Excessive exercise, however, can adversely affect blood cells, thereby affecting overall health. That's all for today. Thank you.